in the sorry. We are a partner in the Rise and Thrive Campus Community Partnership. We provide and support this webinar series, which are all free to attendees. And in addition, the recordings are always placed on our OCI website via the PAA webpage. You can find the past recordings of webinars there, and you can also find upcoming webinars and registration on the OCI webpage as well. Which the information might be in the slides that Ashley so kindly provides for us prior to and after the webinar. So just a little backstory. Rise and Thrive came together through the Governor's Emergency Education Relief Fund under the Coronavirus Aid, Relief, and Economic Security Act, CARES. So we partner, PAA and through OCI, partners with the Ohio Department of Mental Health and Addiction Services, Prevention First, the Ohio Program for Campus Safety and Mental Health, and the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, otherwise known as HEC-AOD. So we have developed these webinars to support campuses and communities working together. And today's topic, which is Better Together, leveraging campus community partnerships to address alcohol harms, is a perfect example, as you'll see, of how campuses and communities can partner together to address a problem of focus. So with that being said, I'm going to hand it off now to Cindy Clowner, who is our partner with HEC-AOD in these webinar series. Thank you, Cindy.
Well, thank you, Juliana, and thank you to Prevention Action Alliance for being such wonderful hosts today. And thank you, all of you, for joining us. I am Cindy Clowner. I'm the Managing Director of the Higher Education Center, and I'm thrilled to be joined by this panel of professionals doing incredible environmental prevention work to reduce harms from alcohol use. We're going to go ahead and start by letting them introduce themselves. And Dr. Lange, why don't you go ahead and get us started?
Sure. I'm Jim Lange. I am the Executive Director of the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I'm also I'm the Coordinator of Alcohol and Other Drug Initiatives at San Diego State University. So I'm actually coming to you from San Diego right now, which between the two centers and the campus, I think gives me an opportunity to both understand some of the national trends, but also what it's really like working on a campus and working with the community as well.
Thank you. Jennifer and Brooke?
Jennifer, you're muted still. I'll go while Jennifer unmutes. I'm Brooke. I am working at Carson-Newman University, which is in East Tennessee, and I'm in the counseling center here. But before coming here, I got my master's degree in social work, where I have a focus on community outreach and community engagement. So at the counseling center here, I do counseling, but I also do outreach and work on different community partnerships and things like that.
Yeah, hi, I'm Jennifer Catlett. I'm the director at Carson-Newman University in the Counseling Center. I've been a licensed clinical social worker since 1997. I've worked in community mental health and also been a part of our state coalition called CHASCO, Coalition for Healthy and Safe Campuses organization. So in working with college students, I've had a passion in looking and working with prevention, and I know Brooke and I are glad to be here today.
Thank you. Molly?
Hi, I'm Molly Linder, and I currently work for Partners in Prevention out of the state of Missouri. And we are the Missouri's Higher Education Substance Misuse Consortium, basically focused on creating healthy and safe college campuses and communities there. And I also serve as our city's chair for our Substance Abuse Advisory Commission to the City Council. And along with that, also do my master's in higher education administration. So I previously was a Title IX coordinator and did prevention as related to violence prevention and other alcohol and other drugs through conduct and things like that. So happy to be here today.
Well, thank you to all of our panelists. So today we're going to begin with an overview around environmental prevention, make sure that we have a good foundation to be able to learn more about specific programming that's happening within each of these organizations and on these campuses. And then we'll finish with a Q&A portion. And so if you have questions throughout the presentation, we encourage you to put those in the Q&A box or within the chat so that we can pose those to our panelists today. So with that, maybe we can go ahead and pull up our slides, and I'll pass it over to Dr. Lange.
All right, thank you so much. So I was asked to kind of give an overview, and then that'll help us with how we discuss the rest of the content. So you can go ahead and go to my first slide. There we go. So when we talk about prevention, I tend to focus on college students. And so a lot of times we're talking about, prevention efforts on college campus, but it's really helpful to have people understand that in order to do prevention, you need to have an understanding of the types of behaviors that are involved, and that those are not necessarily entirely determined by the individual. They get impacted by a sort of growing concentric set of circles, or however you want to think about it, but lots of different levels of influence will have an impact on the specific individual's behavior. So if you're talking about drinking behavior, it is a choice of the individual whether or not they are going to drink, almost always, not literally always, but almost always. But those decisions are within a context of often interpersonal types of relationships. That could be close friends, it could be family. The number of divisions within the circle isn't really all that important. It's more an illustration that there's interpersonal impacts on this decision making, institutional, and that can be the university or other sort of settings in which the behavior may either be happening or be influenced by. And that institution is set within a community. And this is where a lot of times the gap in working with a college campus can be rather great, where the campus may feel like an island to itself, but in fact it's set within a community. And a lot of times what I'll do is I'll point out that there's actually very little either distilling or brewing of alcohol on a college campus. So to think about the community is pretty important if you want to think about the consumption of alcohol. And the same with drugs. There may be an instance here or there where someone's manufacturing, but really the access is coming from the community. And a lot of the times the consumption and the problems are happening in the community as well. So there's community impact. There's also community facilitation of the activity. And so it's very important to remember that it's not just talking to the individual on the campus. It's really this concentric circle of influence. And this is often called the socio-ecological model, or that it's not just the ecology, literally. It's not just the where things are placed and how they're shaped and how clean they are, but it's a social ecology. So how are the influences happening within these levels? And of course, the community has a large say in a lot of the policies that happen, but it also can go even beyond that. So for instance, state level policies around cannabis could change, and that will impact down to the community, institutional, and all the way down to the individual. And so these things can have very broad, or you can think of them as very local, but all will impact that individual decision. And so I'd like to start with that as we think about different prevention efforts. But if you do notice, along outside of those circles, given some examples of things that might fall into those circles, some activities, but the activities don't necessarily have to fall in any of these particular circles. They can go into different levels. And so sometimes we have to step back and look at the actual intervention types of programs or the prevention types of programs. So you can go to my next slide and we'll talk about that. So I've long ago sort of tried to bundle how prevention strategies can be sort of classified. And I've taken a functional approach. So what do they actually try to accomplish? And I've used a kind of an idea of the unified theory of prevention along the physics of prevention. What is it that we're trying to do? And you can think of a very simple physical example. Let's say a ball is rolling towards a target and you want to prevent that ball from hitting the target. There's really basically three things you can do from a physical perspective. One would be to put a barrier, a wall, between the rolling ball and the target. When the ball hits that barrier, all the energy will be absorbed into the barrier. It will stop rolling and it will not hit the ball, the target. Or you could put some sort of channel or deflector. So the ball continues to roll, but hits the deflector and misses the target. So the ball remains, for the most part, having the same inertia. It's just a different direction and will miss the target. Or you could put some sort of repellent force or remove an attractive force, and the ball will no longer be headed towards the target. It could, in fact, go the opposite way even. And those are analogous to the classes of types of focus our prevention programs can have. So when you talk about access, you're really talking about putting that wall between the motivated person and their ability to obtain the substance, alcohol, drugs, whatever. And through that action, they won't be able to accomplish their goal. So they'll still potentially have the same motivation. It's just being thwarted. So that's often in that access control. A lot of times we're talking about enforcement or policies that restrict. And that's basically trying to thwart that motivated person. Another possibility is you recognize that motivation to use is sometimes driven actually by different types of motivations. So for instance, young people are motivated to be out late at night. They're motivated to be in social settings and to meet people and to have friends and to have social gatherings with them. And so that's a developmentally appropriate thing for college-age students to want to do. And but right now, many of the venues in which those occur include alcohol. And so if you take that motivation and you deflect it towards an environment that does not have alcohol, you would potentially allow them to continue rolling along with that motivation, but miss the alcohol or drug. And that's really what's happening when we're talking about behavioral alternatives or alternative events, that sort of thing. It makes perfect sense if you can accomplish it, but it's at basis the concept that the motivation will continue, but the motivation isn't necessarily to use. It is to have social interactions. And then the third is this idea of motivation. And so a lot of our individual focused types of interventions where we try to either educate someone or try to have them reevaluate their goals and what they think a substance can do for them, are really trying to change the motivation from an attractive motivation to use to a less attractive or in fact a negative. And so that's really that motivation. And those three are really the core of what you do in prevention. You can usually figure out a way to describe it within this model in that center. But all of these have a component that can either be supported or thwarted by community action. So if you are trying to offer behavioral alternatives, the community can actually provide quite a bit of that, or they could make it very difficult for let's say, someone to do it by having perhaps sort of occupancy levels that don't fit what young people would want to be. They want sort of crowded environments usually. Obviously, during this COVID time, that's become very difficult. But the community can support these. They can be offering lots of things to do late at night, large groups. Same with enforcement. If enforcement's happening or it's not, that community has a lot to do with that. It also can be a function of where some things are displacement versus actual prevention. And so those are the pieces that the community has. And I always wrap things around with research, because in order for any of these things to really be accomplished, you need to know what works, what doesn't, where you are and where you'd like to be. Are you headed in the right direction with your programming? And so that can be at any of these levels or with any of the particular functions at the core can benefit from that sort of research. And of course, the community can impact whether or not research is happening and can be sharing data or gathering data that can help this process along. So if we think about both the socio-ecological model, where we recognize the various levels of influence, and we recognize also that different types of interventions or efforts can fit within different functions and can have both community support and also whatever sponsor, like a campus support is, you can start to better understand this map or these types of interventions and how they all fit together. And so with that, I think we'll start going right to our next speakers and start seeing some examples. I think I handed, I'm not sure who I handed to.
Yes, it's to me, Jennifer. Yes.
Oh, great.
Yeah,
Sorry for
thank
that.
you. It's okay. Yeah, Brooke and I, that we were asked if you'd like to go to the next slide, would be great. Perfect. And then you can even go to the next slide also. Brooke and I were asked to share some environmental strategies that we have implemented on our campus throughout the years. But before I do so, I'd like to give you a little bit of information about our campus so you can kind of see where we're coming from. You know, once again, we're from Carson-Newman University. We are a Christian university. We're also a liberal arts school. We're NCAA Division II. You know, we have roughly a little over 2,800 students, with more undergraduate students who live on campus. I think what's important for people to know about our school is roughly 60 to 65% of our student population are student athletes. And so that'll give you a little bit of insight as we kind of move forward. And as you go to the next slide, before we implemented a lot of our prevention strategies, it was important to us to identify who were our key stakeholders, not only on campus, but also in the community. And some questions, you know, that we asked were, who can we get, you know, campus buy-in in our prevention efforts? Who on campus and even in the community are interested in prevention? Who and how will they benefit, you know, from our prevention efforts? And so it didn't feel like it was just another task or another job. And then we try to think holistically on our campus prevention efforts of who are our students listening to on campus, who has a lot of influence on campus, also thinking of like money, resources, time, and who has a key ear to our upper administration. And so on the slide, you can see like our Dean of Students, which is important. You know, she's been really good on our task force. She also has become a prevention specialist, but she has an ear to upper administration for us. And one way that she has benefited, you know, is that we help her with sanctions, with basics, Prime for Life, and we can help. A lot of what she does is trying to prevent and to let students know what the healthy expectations are. Another key component is residence life staff. We do a lot of intentional training with our RAs about how to have meaningful conversations with students, and that helps them improve, their community living environment, which is very important. Our campus ministry, since we're a faith-based school, our Department of Public Safety, especially as we move in, to talk about our environmental strategies, you'll see how they've been very critical for us. After we identified our key stakeholders, we then went to identify our community partners. And if you could go to the next slide, here are some of the community partners that we identified to where we both realized that we are both working towards the same goal of creating and having those healthy and safe communities within the community. So not only we are wanting the healthy and safe community on our campus, but also our community partners are wanting a healthy and safe community, in the bigger community. And so the first step we did was we joined CHASCO, which is our Coalition for Healthy and Safe Campus Community Organization in Tennessee. And so we have a lot of universities who are members, and also we have local community coalitions who are also partnering with us. Our community coalition that we partner with is Rescue 180, which is very important to us. They can be our voice in ways that we are not able to maybe topics to talk about because we are a faith-based community where they can openly have those discussions. They also can have billboards and have more money and resources. Also, our Tennessee Suicide Prevention Network has been very important for us, especially over the past 5 years, as our prevention efforts has gone into looking more holistically and tying in very much a mental health component to it. In our local police department, our businesses surrounding our campus, and then also our emergency response team that we work with. And if you could go to the next slide, would be great. One thing what we did, as Jim talked about, we implement the core survey we have done every 3 years. And so we allow data to kind of drive our prevention strategies. And so based on our data, we really chose to focus on increasing barriers and reducing access for our students with getting alcohol. And so in 2014, we thought it was a pretty pivotal time for us as a university, as we were getting a new director of our public safety. And also we were in the process of developing a new local partnership with our local police department, with having police who would have a presence on our campus on a regular basis. What was very important to us because we did not have that before. And so what we did was we went back to our key stakeholders, who are working with us on prevention, along with our local police department and DPS. And we were able to identify what were our high-risk drinking days, our times, and our locations, in our community surrounding our campus, because that was really important to us. And once we identified those, and because a lot of times we might assume what those days are, but in essence, it might be dictated when the local bars, like when they might have reduced drinking nights, or when athletic teams might choose to get together. And so it was important to us to pinpoint that. Then once we did, we continued having meaningful conversations with our local police department, our Department of Public Safety, and we allowed our data to drive those conversations from what we found from our core survey about what were the attitudes and beliefs and behaviors that our students were exhibiting. And so we were able to talk to our police department and to train them of how they can have meaningful conversations also with our students, to where our students could view them as kind of helping them and to create, once again, that healthy and safe community. And then what we did was we increased patrol around the high-risk areas with parties and campus-based events. And our dean, we still actively do that now. She will call our Department of Public Safety And the local police will increase patrol around where we know various houses around campus, various apartment buildings, where there might be some more high-risk behavior going on. Another game changer for us was through these meaningful conversations, we implemented the Live Safe app, which gave our students, kind of empowered them. There's a feature on that where they can send a text message anonymously to our DPS, to our local police, if they have any concerns, any parties, anything was going on. And that's been really good also with our helping us with our environmental strategies, with bringing about that positive change. On the next slide, we wanted to take it a step farther. So we really partnered with Chasco, our state coalition, and also with our community coalition to do a We Check ID. Together, we identified places in our community who are selling alcohol, and primarily places where our students were going to, and so what we did through Chasco provided us with We Check ID decals, and Rescue 180 and myself and other of our key stakeholders on our prevention, we went around to the different businesses who are selling alcohol to our students. We had conversations with them, meeting them where they were at, and letting them know what we were trying to do, with our prevention, and how we were trying to reduce access of, especially our underage drinking, for our students, and asking them to partner with us. And I found that they were very receptive to partnering with us because it allowed them to have a good view in the community, create a safe community for them and also for us. We also let them know that we published and had an article run in the paper about our prevention efforts, about our community coalition, us working together, and also the different businesses who are partnering with us on the We Check ID. So it gave our local businesses a positive publicity, what was really good. And so our community could look for the decals, what were placed in their windows. And once again, we're working together to increasing those barriers and reducing access for our students. On the next slide, we wanted to continue to take it a step further, but not only working in our community, we needed to address our community on our campus. And we wanted to provide our students with accurate information about who we are as a campus and those healthy, safe cultural norms. And we wanted to correct any misperceptions that students might have, especially before coming to campus as a new student. So that's where we focus on changing our incentives and our consequences. And so our dean implemented several notifications, annual notifications to all students, in person early on. Orientation, we express to students verbally, in person, what our healthy expectations are, especially when it comes around substance use. And what the norm is, which Brooke will share in a minute, is that the majority of students prefer not to have alcohol at parties that they attend on our campus. We also chose to implement, as our public institutions were doing, a parental notification policy, that if a student was caught for drinking or substance use, that their parents would receive a letter, and students knew that up front. We also have all of our campus organizations, they sign a form and pledge to keep all the events alcohol-free. We also partner with our campus ministries to provide a lot more alternative spring break alcohol-free trips. We also partner with our community resources to where they are able to do a lot of community work, service work, in the community, which is good. Also, alcohol EDU, all incoming freshmen do that in the summer. We train our orientation leaders how to have these conversations, how they can give out the correct information about who we are, what our drinking is on our campus, what are the positive healthy norms, perceptions. And lastly, we implemented this year for, as I said, 65% of our students are athletes, to where they also are required to complete my playbook at alcohol prevention module for all of our student athletes. Because once again, we really are looking at our environmental strategies, not only in our community and with our community coalition, but also helping shape these healthy norms and perceptions before our students come to campus. And now Brooke is going to talk about even some environmental strategies that we have started to do on our campus now, and even with COVID. So.
Yeah, so you can go ahead and skip to the next slide. So earlier, Dr. Lange kind of mentioned the importance of community in prevention, and Jennifer kind of talked about, for us, wanting to make sure our students are educated with all of the correct information and things. So we have kind of transitioned our prevention strategies to kind of shape the idea of meeting students where they're at, because sometimes the best way to reach out to a community is to go to where they are instead of asking them to come to you. So we've been doing this by kind of changing the physical design of our outreach. So rather than tabling events, we've kind of moved away from that, where we're asking students to come to our table, have this conversation with us. Instead, we're coming to them. So we're doing this with like events and things like that, and social media, something they're already regularly using. So you can skip to the next slide, and I will share an example. Let me move my screen so I can see it. There we go. So here's an example of what this might look like when I say we do events where we try to come to them with prevention ideas. So we do an event in the counseling center called Feel Good Friday. This event is held one Friday of every month. So it's a monthly event that students have gotten really familiar with. And we set up a tent and some tables and things like that at a very centralized spot on campus, where we know students are often walking through, heading to classes or cafeteria, things like that. And we have a bunch of activities that our students have reported they enjoy. So our students love dogs. So we always have 5 dogs at this event. We sometimes have therapy dogs. We sometimes partner with the animal shelter and have rescue dogs come, different things like that. So when students come walking through, they see these dogs and they want to stop and engage and interact. We also have music playing. Sometimes we will have a food truck come, so students can come get something to eat for lunch to kind of change up the cafeteria food. So we do all these fun things where students want to come into the space and engage. And during that time, you might notice in the picture, there is a spinning wheel in the background. We have a different topic at each event that we like to present. So sometimes, since we are the counseling center, we do a lot of like mental health crisis prevention, things like that, where we'll teach maybe stress management tips and things like that. But it's a great opportunity to invite the community as well. So Jennifer mentioned earlier, a lot of the key stakeholders, whether that be in the community or in our campus community, we can invite different departments or different people or different groups to partner in this event, so that they can share their information as well, like prevention information and things like that. And then to bring back the wheel in the background, depending on what the topic is for that event, we have different discussion prompts, and we'll have students come spin the wheel, and we usually have some sort of giveaway, cups, t-shirts, little self-care bags, whatever it may be. They have little giveaways, so kind of like an incentive for students to want to come and spin the wheel. And they usually find that's really fun. Usually have a line waiting to have students come spin the wheel. So they don't even know what we're talking about. They just see a big wheel and think, oh, okay, I want to go join in on that. So something that we do with these events is we bring fun things that students want to engage in while we are doing our partnership and our community work and our prevention strategies. And then we are able to engage in these really meaningful conversations with students where it feels really natural and comfortable, because we're sitting there petting a dog while also giving them resources and this information. And we also usually would have like social norming signs set up around this event as well. So even if they don't stop, they can still kind of see the message as they're looking around to see what's going on. So you can go ahead and go to the next slide. Another example of what I mean by when I say we, meet students where they're at. We've often partnered with our athletic teams. So for example, every fall we host a suicide prevention soccer game, and we're able to partner with not only our community partners like in our campus, but also the community at large. So for example, we were able to partner with men and women's soccer. We were able to have our athletic promotions come and kind of advertise it to all students. Our president and athletic director of the university came and showed their support. But also we had the Tennessee Suicide Prevention Network of East Tennessee, come with different resources and information. And we also had the community newspaper come where they could do a write-up, and now it's kind of reaching more than just our Carson-Newman community, but it's reaching the whole Jefferson City community or East Tennessee community with this information. So an example for this of how we did like prevention, if you'll see in the last bullet point there, one of our surveys that we did, we found out that 97% of Carson-Newman students feel responsible to help a friend who is struggling. So this was a social norming message that we were able to get from one of our surveys. And we thought that this would tie in really great with suicide prevention in terms of how students want to help others that are struggling. So we had that message, but we also have different messages kind of displayed around campus. But this is a really great idea for us with our campus, at least, because it allows our athletic teams to get excited because we come, we bring t-shirts, we get the cheer team out there, we do giveaways at halftime, we have the mascot with like a t-shirt on, and now students come to the game. So the soccer team might have doubled in their attendance because now there was like incentives with free t-shirts and halftime games and things like that. So it really helps with the buy-in of community partners as well, wanting us to come to their space because we offer such the incentive of, oh, we are going to help increase attendance, or we're going to get your game in the newspaper because we're doing this event and it's going to bring attention to you all. So kind of like that mutual partnership there. So those are two examples of things that we do to kind of meet students where they're at in order to best share this prevention information by doing something that they're already interested in anyways, like going to a game or going to a fun event. And then you can go to the next slide. And then just the last way that we kind of meet students where they're at is through our Instagram. A lot of our students have reported that they do use Instagram. So with our account specifically, we don't just post prevention things and social norming messages because we want to make sure students are going to stop and read what we post. So a lot of times we post fun things or supportive things or funny things even that we think that will get student buy-in. And then intermittently we can start to post some of those social norming messages because now we've been able to increase our followers with our funny messages or our supportive messages, and now they want to see what we post. So it's more helpful when we're having that. And then periodically we can put in those really important preventative messages or social norming messages. So that's kind of what we do with our social media in terms of prevention strategies as well. And then you can skip to the next slide. Let me move my screen so I can see it. This is another example of a social norming message, the image there. 96% of CN students do not smoke and most prefer not to have alcohol at parties. So just an example, when I said we kind of have flyers up around our events, that would be an example of like a flyer sign that we would have up. But with all of our outreach events and activities and things that we do to kind of promote these prevention strategies, we are actively continuing to build our relationships with the community. We hope to target more high schools and things like that, because a lot of times it's going to be the local high schools. A lot of those students are going to come to Carson-Newman because it is in their area. So things like that. And a lot of times the community at large can reach populations that we can't reach, or they can do things such as we kind of list like using a billboard that we might not be able to use. So just some things like that. So always trying to continue to build on those coalitions. And then you can skip to the next slide. I wanted to touch on too, diversity as it relates to outreach. I think it came back if you can go to the next slide. Perfect, thank you. So when we are doing prevention and outreach, we always want to be mindful of inclusion and diversity. So we have a multicultural center on campus that we will often connect with when we're doing outreach, just to make sure we're meeting the needs of all of our students and that all students can feel seen and heard and supported by us, so that there isn't a population that feels like they're not being supported. So this includes inclusive social norming messages and events as well. So oftentimes, like when we do our Feel Good Fridays, we will try to partner with diverse student groups even. We have a student group called Young Adults for Equality. And they're actually the group that came out and did the chalking, as you'll see in the pictures to the left there, chalking different messages around suicide prevention as well. So always trying to be inclusive in our supportive outreach too. Then you go to the next slide. So then we were just going to talk about our areas of success as well as our areas of growth. And Jennifer, you're welcome to join in on this as well. But for our success, our events, we believe, have been really successful in that our Feel Good Fridays, again, it's a monthly event. Generally, we impact around 200 students, and we don't just mean like they walk through, we mean they stop and they're going to get a t-shirt or they're having a conversation or spinning the wheel. We've done check-ins, and so we've got about 200 students, and 100% of the time, 100% of the students that we talked to said that this event, you know, relieved stress or they enjoyed it or things like that. But we're also giving them really helpful information while they're at that event. And then, for example, our prevention soccer game, we were able to give out 500 t-shirts that did have a social norm message on the back. So that was really great too. But of course, we have areas of growth that we're really hoping to work on. One of those being diversifying our staff, not just in the counseling center, but at the university at large. Another one, we do have challenges being a faith-based school. There's things that we can't really do or talk about on our campus that might be really important to talk about. But in some ways, we're a little bit limited in that area. Like, for example, like having a student recovery group would be really, really important. And we do have a lot of students that could benefit from that. But at this time, we might not be able to do that. And then I'm sure a lot of you can relate. Money is an area of growth. We want our money to grow. So it would be nice if we had a bigger budget where we could hire a prevention specialist, because right now it's kind of counseling services and the dean of students partnering and working together to take on this role. But if we had more money, we could hire a prevention specialist that, you know, would be really beneficial. But we're doing the best with what we've got and what we can do. But of course, there's always areas of growth. And then Jennifer, if there is anything you wanted to add to that slide, otherwise I think that's what we had from Carson-Newman for you all.
Thank you, Jennifer and Brooke. I want to pass it off to Molly, our next panelist.
All right. First off, I think we all wish money grew on trees, especially when we talk about prevention efforts. And you can go ahead and go to the next slide. There we go. So once again, I'm representing Partners in Prevention, which is out of the state of Missouri. And you can go to the next slide, and I will sort of give you an overview here. Partners in Prevention, once again, as I said earlier, is Missouri's higher education substance misuse consortium. And we have over 24 campuses that we specifically work with in the state, but we also work with numerous other institutions throughout the state as well. All of our partner institutions are required to create an annual review, participate in our survey called the Missouri, it's called the MOCB, the Missouri basically Health Behaviors Survey. And so we're able to do that annually, which is great. So we can really see some great long-term data about what's going on. But our main focus area is decreasing at-risk drinking by the students on our college and university campuses. And that is the primary focus of our organization. And we are completely funded through different departments in the state of Missouri, as you can see down below. And so really we're, depending on the grant we have at that time, that's what we're working on in different ways. We also help develop campus community coalitions, along with a communication network to really get our relevant state agencies to be able to connect with our campuses. And therefore, we can really help look at what effective prevention strategies there are for both alcohol and other drugs. As I mentioned before, we do an annual evaluation of those behaviors and also those related consequences, which also help us then inform what we're going to do when we talk about prevention strategies. And I will note we have our big public institutions like the University of Missouri, but we also have community colleges as part of our partner institutions, as well as small private institutions. So we work with a bunch of different people and try to figure out what is accessible and equitable to each of those campuses and what might work best for them. We also facilitate those evaluation efforts and really look at and doing research for the effectiveness of policy changes, how programs can be implemented, so on and so forth. Thankfully, through grants, again, we are able to assist our campuses with those intersectional campus health and safety concerns because we do know that alcohol and other drugs and the misuse of those are at many times related to, say, suicide prevention, mental health, safe driving behaviors, tobacco cessation and prevention, violence prevention, and even problem gambling. For those of you who don't know, the state of Missouri has a fairly robust lottery and gambling system. And so that is one of the bigger things. And because Anheuser-Busch is within the state of Missouri, we have very, I shall say, lax laws when it comes to alcohol in many ways. So those are, some of the reasons that we are able to address these pieces through Partners in Prevention. And if you go ahead and go forward, the next slide. Currently, these are some of our initiatives. And I'm guessing you guys are going to send these slides out, but each of these does have a link to the different programs. We have a program called Cheers to the Designated Driver, where we partner with different bars in each of our communities and restaurants, and we ask them to provide free sodas sodas or drinks or whatever to the individuals that are maybe the designated driver that night. And in exchange, we're able to give them different items to have within their establishment. We also work with the Missouri Department of Transportation for a Drive Safe, Drive Smart campaign. We were able to put together a training called Party Safe, and it's really for our students to look at how they can host responsible events. And then we have SMART, which is the State of Missouri Alcohol Responsibility Training Program. And I'll talk a little bit more about this when I talk about my work with the Substance Abuse Advisory Commission. We have a program called Ask, Listen, Refer, which is all suicide prevention based and really figuring out how you, as maybe a just person that is a college student or even a community member, might be able to assist in preventing suicides. Macro is our Alliance of Collegiate Recovery Organizations. And actually through COVID, we were able to start an initiative called Recovery Corner, where we've been inviting students from across the state and from our institutions to participate in virtual recovery programs, not focused on any specific method, but really just a place where they can come together and talk. And during COVID, that has really, that took off and has been very helpful for a lot of students. We also have a grant that is focused directly on preventing prescription drug misuse. It's called MoSafe RX. That grant is geared towards our HBCUs, historically Black colleges within the state. And that's because our data from the MockB survey showed that that's where higher levels of drug misuse were occurring. And so we were able to use that grant and still are using that grant to reach out to those organizations. And I will, when I'm done chatting here, I will go ahead and put a link to where you can find all of these initiatives on our website. We welcome everybody to look at them and use them as you can. So if we want to move to the next slide. As I said, also, I am the Substance Abuse and Advisory Commission Chair for the City of Columbia. And the City of Columbia, Missouri is where the main institution throughout the state is located, and that's the University of Missouri. There are also multiple other colleges and that exist within the City of Columbia, including a couple, one small private institution that also has satellite campuses throughout the nation. Many of those are on military branches. We have a couple different community colleges, and then we also have an all-female college, private institution here in the city. So we have quite a few colleges that we're working with in a honestly relatively small city. If you think about it, we're just a little over 100,000, not counting students. We are thankful to have a city council that a while ago decided they wanted to have a commission that was focused on how can we decrease substance use and abuse, and also, promote the coordination of those programs that are trying to do that throughout the city. And so you can see sort of what the mission of the institution is. And I will say part of this is because all of those colleges I mentioned, we have the University of Missouri on one side of our downtown. At one end of our downtown is the female private institution. And then honestly, bordering on this side of the downtown is the other private institution. And so all of our students are obviously very close together. They're within honestly a mile radius. And so it's important to keep that in mind, specifically because that is where our downtown is and where many of our students therefore are engaging in behaviors that might not always be the most healthy. So our commission is a 10-member board. They do ask that everybody has a demonstrated interest in and concern for any of these substance use problems within the community. What I love about the way this board is operated is that it's not just people that are appointed. We have 5 members appointed by our city council, but then, and that's through a process of actually going in and saying, I want to be a part of this. You fill out, all of that information. But we do have a requirement that 1 member must be a prevention or treatment professional. 1 must be a healthcare professional. We do, based on the fact that there are so many students in town, ask that 1 member has to be a student under the age of 25. And then we have an appointee from the University of Missouri, along with an appointee from the Columbia Public Schools. And that's our main public school system here in the city. We do have a health department and a Columbia Police Department liaison that are included in that to help provide that community approach as well. And then our local youth community coalition, YC Squared, attends all of our meetings as well to provide updates on what they're doing with things at the high school level, and honestly the community pace for our 12 to 18-ish year old individuals. Once again, you can see the purposes, and I hate reading to you all here, but these purposes and objectives are established ordinances within our city, which once again, I know there's privilege in being able to say that, but these are within our ordinances. And so we are able to advise the city council. We can make recommendations. We also help promote the coordination of programs, and then also promote policies of intergovernmental cooperation to strengthen those existing programs that might be out there. So I will say all of that is a lot, but once again, I have also been working with other communities nearby to really look at, is this something that's viable to have within their community? Because any community has concerns with substance use and abuse, and especially when we start looking at the opioid epidemic and things such as that. And so how do you utilize the things you have at your hands and that already exist, such as your city councils, to move and progress your own mission in a further way. So if you want to move on to the next slide. I'll say, so here are some of our current and past initiatives, so those that are completed and also those that have been recommended. And a lot of this stuff is a partnership through Partners in Prevention, the University of Missouri, and then our Columbia Public Schools, as well as then our commission, as we're able to go to the city council and truly put these things into words, have those town hall meetings, and then specifically then hopefully always get those to a point of becoming ordinances or recommendations. So back in November of 2011, we were able to put a server certificate requirement in place. So anyone who is a server of alcohol within our city is required to have a certificate that they have gone through a program to show them how to serve and understand over service and those sorts of things. Our SMART program that Partners in Prevention developed is one of the main methods that is used as a tool to receive that certification. It's not required, but it is the main mode that that we see our servers utilizing to receive that certification. And so once again, that's a great partnership that we were able to work together, because PIP, Partners in Prevention, was able to use our grant funds to then assist the city in allowing or in figuring out how this server requirement could be met. In September of 2016, we actually were able to not push through, that sounds awful. We were able to work with our community and the city council to require both our Columbia Police Department and Columbia Fire Department public safety personnel to all carry naloxone, and also to make sure that there was a line item within the budget for the city that they will continue to provide those resources. And we do continue to hear to this day how it's been incredibly helpful for them to have that. At first, of course, you see some pushback. Our sheriff's department is still pushing back on it, but it's been helpful, obviously, specifically now with fentanyl showing up in so many other drugs as well. It's been helpful for these individuals that are first on scene to have naloxone available. In March 2017, we were also able to establish a citywide prescription drug monitoring program. We helped back that in coordination with the Board of Health. And many people will say, why didn't you already have a prescription drug monitoring program that existed on a statewide level? Well, lucky Missouri, we were the last state in the entire nation to adopt a prescription drug monitoring program, and that actually just took effect this year. But you can see, and I've got the links down below to our different city ordinances for both that server certificate as well as the citywide PDMP. I'm going to go to the recommendations, and then I'll go to the COVID piece here. But some of the recommendations we've made, and honestly, at times received pushback about, but back in November 2008, we did request that council consider redirecting fines from violations involving alcohol sales to minors, to then helping to provide resources for an alcohol compliance check program. As with anything at a statewide or citywide level, obviously funding, once again, we all wish money grew on trees. Funding, unfortunately, cut a lot of what our statewide compliance checks might have been doing. And so what we were requesting at that time, well, I should say the commission was requesting at that time because I was not here, was asking, hey, so when somebody is fined, why can't we put that towards a compliance check program? Unfortunately, once again, that was not implemented. And then in July of 2013, we did request that they consider allocating a portion of, we had a savings from a 911 tax to the creation of a specific position within the police department, so dedicated to alcohol enforcement prevention. As you can guess, once again, money-wise, that just was not able to occur. More recently, I guess 6 years ago, in 2015, we recommended a schedule of administrative penalties to be adopted for violations of liquor license standards. And our liquor licenses go through our business office, which I've been told is not always the case. And I don't know how it is in the state of Ohio. But so really, we wanted to see, okay, can we have this schedule of, you've got this happened, so you're at this place. Okay, so what if another thing happens? What is that next penalty? What is the penalty then at the next level when maybe you're shut down for a week? And what does that then do to impact your business? Unfortunately, once again, that was not implemented. More recently, we did do quite a bit of research and work to look at ordinances related to drink specials and alcohol outlet density. And that was directly in response to a city-directed hospitality zone assessment for our downtown area. And that was completed by a national organization and institute. And that was because there have been so many issues with overservice, alcohol consumption, violence due to that within that downtown area that is bordered by our colleges. Unfortunately, after several town halls and many communications with our bar owners and city council, that was sort of put by the wayside. But so more recently, we have looked at the possibility of partnering with our bars and restaurants and how we can help to move those pieces forward. What can we, as even partners in prevention, provide to assist in, say, putting out social norming messages in our bars? I will say I am thankful, and this is because I am also part of the business community through my family, but I'm thankful to know a lot of our bar owners and restaurant owners. And so I get to have very frank conversations with them and go in and talk and say, hey, let's look at the environment of your establishment. Are you seeing places where maybe there are some issues? But all of that I can then take back and we can utilize to say, okay, let's talk about safety things that are easy to do that don't take money, but can really make a difference. And so those are some of the things that we still are able to do. As with COVID, I think a lot of states did have ordinances and or state laws that came out. One of the ones that the state of Missouri had was the allowance for to-go alcohol. And so that was officially implemented on a statewide level through the passage of a Missouri Senate bill that went into effect in August. And so to-go alcohol is here to stay in the state of Missouri. Of course, there are requirements for how that can occur and how that happens, but that is one thing that is here to stay and something that we are looking at. I will note another thing that happened during COVID, though, that was very interesting was as we don't have any drink special regulations within the city, nor do we have any at the state level, because once again, Anheuser-Busch has a lot of pull within the state. We did see during COVID, when a lot of businesses and restaurants were shut down, that a group of establishments that did stay open decided to band together and say, we're not going to do drink specials during this time, specifically until a few other bars that they knew would continue doing drink specials would do that. But it was wonderful because we were able to hear positive feedback from those establishments that did band together and say, we're not going to do this during the COVID shutdowns. And so I hope that we are able to then use that at a later date to move some other things forward. You'll notice a lot of what we did sort of stopped at and we were doing other things, but sort of took a pause with COVID. And so we have not been able to move anything further with drink specials and alcohol outlet density things, mostly due to COVID and the other things that public health related have taken the forefront. So I think I have one more slide. And so some of the other intersectional initiatives, we do have an annual bar owners meeting that includes representatives from our commission. We usually also have Partners in Prevention be a part of that, and they will provide, refreshments, cookies, whatever. And we have also, one of the things I will say that's been awesome about that, we're able to partner with some of our establishments. And we have found that whereas we used to have this meeting on one of the campuses, we found that our bar owners were much more likely to come if it was actually happening at a bar. Not that they were having drinks or anything like that, but just that it was in an environment that they were more used to. And so I think that's something to take away, is that, think about, as somebody said earlier, meeting their students where they are, meet the people who are actually doing the service where they are as well. And we do also invite our bar owners and establishment owners to serve on campus and community coalitions. So they have a piece of involvement in that. We use that SMART program I said. We also have a lot of data that we can pull for them, and that's through Partners in Prevention. And then we can also provide technical assistance. I think I mentioned the door person and training piece earlier, and that's something where we're working to see, can we utilize that SMART program to add in a module about if you're a door person or you're standing out there as security, what can we do, or how can we also engage them in additional information? So, and you can move forward. And then I was going to say, because I know a lot of this is about building your coalition. We have a full coalition building toolkit, and I'm not going to go through all those steps there, but it is, if you were to visit that site at the bottom, you will see worksheets to basically help you completely build a coalition, what pieces to think about, where, how you sustain that, how you can make a decision-making process, how you can facilitate your coalition meetings. But we welcome the use of this, and I am so thankful for another member of our PIP staff that worked tirelessly to put this together, and I just definitely hope you all can make use of that. So, thank you.
Thanks, Molly. I'm just dropping that toolkit link in the chat so that everyone has it. We'll go ahead and pass it off to Dr. Lange.
All right. Thank you. And I'm looking forward to getting that coalition manual as well. So thanks. All right, I'm going to talk a little bit about some programs that we are doing as part of the Higher Ed Center in partnership with the Ohio Office of Traffic Safety, Ohio Traffic Safety Office, funded through that, and also with RAD, which is Rockers Against Drunk Driving. You can go to the first slide or next slide. Just to put some context, when we talk about impaired driving, a lot of times campuses aren't really doing things that are specifically impaired driving interventions, in part because, as I said before, a lot of the behavior is happening off the campus and in the community. And so it's both sort of not seen, but it's also hard to imagine how you do prevention programs when you are kind of the island of yourself. So it really is something that lends itself to community campus partnerships. But what I wanted to do is give a little data to put some context around impaired driving. These are some results of the spring 2021 NCHA. NCHA is a National Collegiate Health Assessment. It's hosted by the American College Health Association. And a lot of campuses across the nation deploy this particular survey. And but it's not a nationally representative sample. It's voluntary if a campus wants to pay in and put this survey on their campus, and they can be varying types and size campuses all kind of mushed together into one thing that the NCHA folks call the reference group. But you can see a couple kind of interesting things. And what I've done is I've done this analysis in a way, just using their basic frequencies, recognizing that the way they ask the questions, like a cannabis user will get the question of whether or not they have driven within 6 hours of having cannabis, but someone who has not used cannabis won't get that question. So reorienting it so that this is representative of the whole sample and not just cannabis users. And you'll see that there are alcohol injuries, people saying that they had some sort of injury related to their drinking, not necessarily driving. but accidental injury is the leading cause of deaths amongst college students in the United States. And a large portion of those injuries are alcohol related. Now, many of them are also vehicle crash related. And when we ask, when the surveys ask about if a student has driven after alcohol or driven after cannabis, you can see, and this is in, I think it was the last 30 days, that a substantial number of students have done that in the last 30 days. And it's hard to do the mental gymnastics, but because it looks like, oh, well, cannabis is a little bit less than alcohol, but in fact, there's a lot more alcohol drinkers than there are cannabis users on campus. And so when you look at it as the proportion of people who drink or the portion of people who use cannabis, there's a dramatic difference where cannabis users are much more likely to drive after using cannabis than an alcohol drinker. Regardless, we got a relatively large number, you know, in the 1 out of 20 in the last 30 days have done this. And then you skip over to the far right, you'll see that quite a number of students get in crashes every year. This is annual. And now they weren't asked in the survey whether or not these are related to their alcohol or cannabis use, but crashes are relatively common. Now, the two things that I skipped over is whether or not a student will have gotten in trouble about their drinking, another set of questions. And you'll see very few students will encounter police or get in trouble with police about their drinking, and very few will get in trouble at the university level because they're drinking. And so if you're using things like the number of students who will go through a judicial process on a campus, you'll see that you'll miss a huge number of students who are doing a relatively risky activity. And so again, why is it that campuses are not doing very much around impaired driving? It's not seen and it's not coming through their judicial, but it is a high risk activity associated with consumption of alcohol and using cannabis. So we can go to the next question. And there's been, next slide, sorry. And there's been a little bit of data on this. This is from a study that's been done for years, where campuses are asked to report on their types of programs. And the green and the red lines on this graph, which are, if anything, kind of heading down, are basically the types of programs that we're measuring about impaired driving. Other types of programs, like those for recovery, have either stayed the same or kind of gone up relatively recently. And individual motivational interviewing, those types of programs have been relatively common. And so the combination of this, as I said, it's not as likely that a campus is doing anything, whether or not they're doing anything evidence-based. And if they are, it's possible that it's been going down over time, is of concern. And the other component here is with COVID, restrictions and changes in traffic patterns, there has been the largest increase in impaired driving across our nation. I think it was since 2006, with about 15 years of progress wiped out in this last year. There's a very large number of impaired driving fatalities and crashes that have occurred across the nation over these last 2 years. And so it's timely to be talking about ways to try to claw back some of the progress we had before. And this is where community and campuses could be working together. You can go to the next slide. Thank you. So as I mentioned before, when I think of countermeasures or prevention programs, think of them in the in that context of the functional approaches, where you could be looking at motivation, access, and even when you're talking about DUI, there's motivations and there's enforcement, which is often access. If you're concerned about the ability to drive impaired and not get caught, that's a way of restricting the access of it. And then there's alternative focus, safe ride programs, designated driver, mocktail, consumption alternatives, those types of things, where people can do what they were trying to do and still even consume alcohol or other substances, but avoid driving. So that sort of rubric, I find a helpful approach. But if we go historically, a lot of the focus has been on raising the perception of enforcement risk. You can go to the next slide. And within that, actually, I'm going to skip back because I forgot about this slide. So we're often trying to, within this, is to change access. We want to increase coordination with police, restrict alcohol, compliance checks, those sorts of things, responsible beverage service training. Those tend to be access control. And you could even think of, like here at San Diego State University, for I think now it's 13 years, we've had very large scale alternative programming late at night. Starts at 10 p.m., goes till 1 a.m., where we literally will, for instance, put a carnival with Ferris wheels and other rides on campus, attracting about 5,000 to 6,000 students late at night, and there's entirely alcohol and substance free, where you're basically creating a fully restrictive environment, but that meets those developmental developmental needs of the students to be around each other, meet people, and basically have fun late at night. And so those are environmental, but they work in various ways. So we'll go ahead and go to the next slide. Sorry, it's a little pixelated. This is actually a really old slide because this was something that we did here at San Diego State over 20 years ago. The project was, but it was using a town gown coalition, a coalition of both the campus and community and the hospitality industry to basically do a heavy enforcement around campus. But most importantly, that enforcement was paired with a very high profile marketing campaign, because we long ago observed that you can have heavy enforcement, but if you survey people, most people haven't actually seen the enforcement. They aren't out at the right place in the right time to see the police. They probably weren't stopped at a roadside check. And so the only way that it's going to have a community effect is if people know it through other means. And so a ad campaign saying there will be a major enforcement activity does increase, even for those who don't actually see it. They will have heard about it and they get worried about it, and that can change behavior. And we actually have about a 20% reduction in impaired driving amongst our students compared to a control school with this approach of social marketing and heavy enforcement. However, in today's context, this image of someone sort of having their face pressed against the ground and the idea that your weekend's going to suck as the pixelated image says, isn't really something that's going to resonate probably in today's for today's students. In fact, this could be triggering something that a different set of issues than what we're hoping for. And so a lot of us are trying to come up with programs that can either still enhance the perception of enforcement or work in other ways. And you can go to the next slide. And so stepping back a bit, and again, understanding the social context that let's say drinking occurs within, and how impaired driving might be an outcome of that. We recognize that young people, especially when they go out in groups, and something we started calling natural drinking groups. And natural drinking groups are if you ever are around a campus, perhaps they have fraternities, sororities, especially fraternities if they're hosting a party. You will not see individual students walking to that house to participate in that party. They'll be in groups. They travel in packs, and what we did is a study that demonstrated that within those groups there's dynamics, and those dynamics are relationships and also roles people play. Often there is like a caretaker role that emerges. There might be someone who has access to the alcohol or the venue or stuff like that. So understanding that this is group behavior provides us with a set of tools, or a set of levers to have individual impact that may have been not possible when if it isn't coming from within the group. You can go ahead and go to the next slide. And so, here's the definition. It's distinct from the idea of a peer approach. A lot of times when people say peer influence, it's a rather vague topic or vague idea. They may mean everyone that age or everyone at the school, but this is actually friend groups that are formed to participate in some sort of drinking or social event. And that slide before really was trying to look at how do they form, what's their structure, what's their dynamic, and their deconstruction, because deconstruction is important as well, because a lot of times we talk about designated drivers, but the designated driver really is to be part of the functioning of that group. If the designated driver leaves, for instance, without everyone in the group, then there's been a failure to use it appropriately. And in fact, we did a study where we breath tested drivers and just got a warning on time, so I'm going to go a little faster. We'll just skip right up to this next slide, and take a look at this. Was an experimental process we did where people were randomly assigned into different types of conditions around designated drivers, and then we breath tested the person who identified as the driver after they attended the event. This happened in the border of San Diego and Tijuana, and the far right, you'll see the group norm. If we had someone in the group ask the question, randomly assign them, ask the question, who's our designated driver? They reduced the consumption of the driver dramatically. In fact, it was about 80%. So using that idea, you can go to the next slide, we've been doing different types of ways of cueing the concept of who's your designated driver, picking your designated driver, having the group decide that at the right place at the right time. And as I said, we've been funded by the Ohio Traffic Safety Office to work with RAD to create a venue-based program, so concert music venues, so that there are cues around what we're calling using your RAD squad to make sure everyone's going to get home safely. Putting those cues in the venue is helpful because that could be where drinking's happening. And if you put the cue proximal to the consumption, you can get that effect that I just showed. But it's also a way to build a community approach where young people who are attracted to different types of music genres and activities can start seeing the message both in those venues and perhaps ancillary businesses around the venues, but then having that echo on college campuses. So go ahead and go to the next slide. And we'll probably skip through some of these slides. So this is our target. We have campus partners, the Ohio State University, Cleveland State University, and the University of Cincinnati. And they were starting to put activations on their campus that echoed what we were about to do in the venues. Now, COVID hit. And so obviously the venues shut down and needed to shift our approach to mostly social media. You can go to the next slide. And I think I've pretty much said much of this, so go ahead, and I'm just going to show you a little picture of, on social media, we started inviting local bands to do Rad TV YouTube channel content and shifted it to that level. So again, we can still have the messaging and have it a natural piece coming from people students are interested in listening to, and have them make that plan and make sure that they drive safely. You can go very quickly through the slides all the way up to the very last slide. This is just some of the materials that we have created, some of the types of performers, but most importantly, we are interested in Ohio campuses who may want to help spread this marketing approach. So as we are moving back into venues, venues near your campuses may be seeing these messages, the Rad Squad message and the efforts there. And you can use this link if you're interested in getting some of the materials so that you can on your campuses or within your community help echo that message and facilitate it so that students will know what we're talking about when we talk about Rad Squad. And when they see this in the venues around the community, it will be a message that they already understand that should be effective at helping reduce impaired driving. And so I will hand back the balance of very little of my time.
Well, thank you, Dr. Lange. We certainly packed a lot of information about potential environmental prevention strategies into an hour and a half. I know we only have 2 minutes left. I don't see questions in the question panel, but perhaps one way that we can wrap up this panel before I pass it back to Juliana, if our panelists just in 20 seconds could tell us a piece of advice that they would give our campus and community partnerships that are working together on this, what would be one thing you would share with them? 20 seconds or less.
I would say do an environmental scan. Start to understand where the venues are, what's attracting students, where they're getting things, and where the trouble spots are. And there are some online you can find them, or other places you can find what those look like, and help those data make your work strategic.
I would say involve students. If that's the community that you're wanting to impact, then I think it's good to involve that community in that.
Okay, I'll go next. I will say to continue to keep assessing the attitudes and beliefs of the students. I know we've done the core survey every 3 years. We now are doing the Healthy Mind survey that Jim Lange talked about earlier, every 2 to 3 years. Also stay actively connected with your coalition and be patient and continuously assess the readiness for change in your community and on your campus, because I find every 4 years, attitudes and beliefs of the students who are working with, it seems to be shifting and changing. And so that your campus prevention is always going to be changing also.
In addition to everything they said, I'm going to say make sure that you don't see each other as the enemies from a community versus campus standpoint. Often prevention individuals see their bar owners or that sort of person as the enemy, and it actually helps to just go in there and be a real person and talk to each other as real people.
Thank you, everyone. Juliana, I'll pass it back to you.
Great. Thank you, Cindy. And thank you to all the panelists for providing such thorough and applicable information. I look forward to how it will be used in our OCI network. I do want to mention, Jim, you mentioned an environmental scan. OCI actually is partnered with M.Ed, and we are conducting a statewide survey on student behavioral and mental health, not just from the students' perspective, but also from campus professionals and administration and staff. So I highly suggest that if you get an email from our partner at M.Ed suggesting that we have this survey, I highly suggest that you participate. And if you have any questions about the survey or haven't got an email and would still like to participate, you can contact me directly and I would provide your information to our lead researcher, since I can't actually send it to you myself. And I Sorry, I was just muted. I must have hit bumped a button. But I put my email information in the chat should you have any questions about the survey or want to participate but haven't heard anything about it or anything like that. We will have another webinar in January. On January, I want to say the 9th, but anyway, we will post that. 12th. Thank you, Ashley, or whoever said that. And it will actually be on a topic similar to what was presented here, but through the experience of a student community liaison who works at Johns Hopkins University, who has a ton of experience of how to involve the community in student type initiatives concerning alcohol awareness, housing, and that sort of thing. So this will go right along with what that liaison is currently working on at Johns Hopkins University. And it's been he's been there for 9 years. It's been a very successful program. So stay tuned for the registration link coming. Oh, look, Ashley put it in the chat. See, DJ. Anyway, we look forward to seeing you all again in January. And if you have any questions at all about any of these webinars, you can reach out directly to me or go to our OCI webpage and, access for more information there. And also the Rise and Thrive tab is on the OCI webpage for any additional information. So thank you again. I hope that everybody has a nice holiday season, since that's the next best thing. And have a good rest of your day. Thank you.